on this computer. Admit Shona. So welcome everybody to our dispatches meeting today, 13th October, and we are going to go through the agenda we circulated earlier. The first part is, as usual, a general update. Update on level of activities first. The level of activity is still very low, and it might just stay this way, we don't know, but just looking at the tracker, there's very little happening in the different zones. There's a few prescription and a few bits and bobs of not a huge amount of task at the minute. Jen, can you keep an eye on the admitting as I speak? Is that all right?
You might have to co-host me, don't you?
Okay, let me co-host you then, because otherwise I won't be able to talk and make. I can only make you host, not co-host. How weird is that? Never mind. I'll keep a look. So yeah, the level activity is as it is. If you keep, please make sure that if you got any requests, you keep them in the tracker. If you, some of you had lost a link to the tracker, we resent it. It still works, so all the trackers are still there. If you haven't used a tracker before, give us a call. We'll show you how to use it for all the new dispatchers who've joined us. So talking about dispatchers, so what we did after the last meeting we had about 4 weeks ago now, we contacted all the dispatchers on the list and asked who was still able to continue to help. And then in area where there were less people available or potentially not enough people, we asked for new people to join us. So we now have a new list. It's a shorter list. I think before that we were about 60 across our 20 zones. I think now we are closer to 44, something like that. I can't remember the exact number on the last count, but what we've done is then we've finally used that list in the letter. That's why it took so long, because it's not always easy to find people to join. And then we've also shared that new list on the Facebook group. And today, I believe, Jen, I've seen earlier you've changed the name on the website as well, haven't you?
Yeah, that's updated.
So the website is also updated. The letters are now with us. So hopefully that part of the list of things to do is now complete. So welcome to all the new dispatchers, and thank you very much for joining us. We need you, so that's great that you're here. Then in terms of number of volunteers, I wasn't quite sure if to start about that now. I might not talk about that now, actually. Yeah, I think the first thing now to do is to look at the protocols and to see what your opinions are as well. So I might just share my screen, just check anybody to be admitted. No, everybody's here. So if I share my screen quickly and go back to the website, so hide that. So the website, we've had a look at it over the last few days and tried to update it. Like I said, the homepage has now got all the new numbers. I hope my internet's not going to be too slow. It's very, very slow. Yeah, it's there. So yeah, all the new numbers at the front are there. So if you want to direct people to it, please do. Yeah, they're all there at the bottom. So all the way to Westfield. So yeah, they're all there. And then obviously, if you're a new dispatcher, the page that's really important for you is that tab here, Rye Mutual Aid. He explained who we are, so that hasn't changed. I'm not even going to show how we work in case you haven't had the chance to see that. We haven't changed that. It's the same way it was, which is a resident calls a dispatcher. And we accept the request. We normally we refuse the request. It's not really like refusing. It's normally we're trying to direct people to other possible option, so that we are really the last call for people. So if they can do ordering food online, if they can ask their neighbor, their friend, that's what they should do first. We're only here as a safety net in case there's absolutely no other option for them. So then we accept the request, and then we send out that request to our group of volunteers in our WhatsApp group or Facebook, whichever way you want to communicate with your group of volunteer for your zone. And once a volunteer comes forward, then he tries to complete the request. And if he can't, we try and work out why. Was it a lack of supplies? Can we help as a central team? Can we make alternative arrangement? or yes, then it's done. And if they do it, which is most of the time, then they go back to their dispatcher to inform them that yes, they've delivered the medication, and then the dispatcher can then upload and update the tracker online. So that means that we know that this has been done. So have a look at it. I'm not going to do all the different branches, but it hasn't changed. So that's the same way we've worked always. Become a volunteer, we haven't changed that either, and we're going to be talking about recruiting volunteer just next on the agenda. In terms of protocols, we've changed, and I'm just going to go quickly through those. And these are still the same protocol we've always had. We've updated them to follow government guidance, as well as to make them potentially more practical and simpler. Our aims, ethics, and guidelines haven't changed. We're just an independent group, and we're just here to help. Have a look at that. I'm not going to open it. Listening support. We've checked with the listening support team today, and I think except from Kim, who is moving out of the area, the other 4 people in the list are still with us. So if you ever need, and if you ever receive a call from a resident that expressed distress or despair, well, that's actually would benefit from a friendly call, but that doesn't express distress or despair, because then that's another line of work. But otherwise, you can then refer them back to the friendly chat. If it is distress and despair, then if they're not in immediate danger, then that's when you do your you take information about them, and then you refer them to our listening support team. So that's a different way of doing it. If it's just a friendly chat, people want to chat because they're a bit lonely, then you can ask any of your volunteers. But if that person seems a bit distressed, a bit desperate, then actually try and use instead the listening support team, because they're made of people who've experienced, either because they're nurses, they're counselors, they're psychiatrists, people in the care profession, so they will know how to handle it. So again, very important to look at that protocol, because if these people are in immediate danger and there's nobody with them, you will have to call 999. So have a look at that flow chart, and that's a very important one for you to look at. So if I go back, then the shopping and medicine has changed as well. Just pointing out what has changed in this one. We've made it simpler. It's only a 1 page now. That's nice. And we've taken out the idea of the gloves. You're very welcome, of course, to carry on using gloves when you go shopping. But the latest recommendation, we say that it's better to just wash your hands very, very often, have disinfecting gel with you, and make sure that you are keeping, obviously, as that kind of hygiene protocol as you go and do your shopping. So we've updated that one today as well. In terms of payment, I don't think we've changed very much. Volunteers with COVID, we've just changed the image because it was an old one that didn't really include the loss of taste or smell. So, but otherwise, that has not changed dramatically. What I would say is we've made it a bit simpler as well. And it's just about making sure that you trace back your step. If you've had symptom, you self-isolate for at least 10 days, you inform your dispatcher. And if it's somebody in your household, then you self-isolate for 14 days. Again, that's following government advice as of today from that website. And again, there's advice about the fact that we are in a group that's at risk because we are going in the community. So we've got to be particularly careful. And as soon as we got signed, we need to stop volunteering. We need to be very, very careful and follow protocols so we do not contribute to the contamination in our community. And then finally, the risk assessment. Anthony has updated the risk assessment as of 1st of October, and you'll find the latest version in the website. So please do have a look at it, again, to include loss of smell and taste as well. And then you've got all the other hazard and mitigation. So I just wanted to do that. And then the last one I wanted to show you is on the dispatchers page. And I'll share the new the password in a minute, because I think it had changed. The one I had didn't work, so I changed it to the one I was told should work. It's the wrong one now. dispatchers, just to show that if you've got to contact the listening support team, you got to go to the dispatchers page, which is password protected. I'll send you now the information. Don't worry too much about that checklist. That was right at the start. You now know what you're doing. It's just the new codes are there. If you've forgotten the Zoom code, it never logged out and can't remember. And these are the 4 people that are still with us on the listening support team. So at that point, you would have to call them one at a time until you get somebody answering. If none of the 4 people answer, then contact the central team and we'll take it from there. And that was mainly the changes. What I would say is we're going to invite people on the volunteer page, and you, if you know, to review the local offers, because they're very likely to have changed quite a lot. I think the last time we updated that must have been in April or something, maybe May at the best. So that definitely, probably, if you know of any changes, have a look and let us know. That hasn't changed. And then again here, if you know about that one, I haven't updated the doctors, pharmacists and dentists. It would be nice to know if that information is still valid. So if you know from your local pharmacy, local doctor surgery, have a look at it. Let us know if we need to change anything. And finally, the thing that we will need to change is check all the links there that we haven't changed. So that was a quick run through. I'm going to stop sharing for a minute and see if there's any question about the protocols and the changes. Are you all happy with the fact that we don't wear gloves anymore? Is that okay? Yeah. Okay, fantastic. So I didn't do a poll for that in the agenda. So okay, halfway, good. Now the next part is about recruiting volunteers. So I'm just gonna put a couple of polls out there. First of all, before I put a poll, because I couldn't do a poll for that because I needed to know the name of your zone, could you put in the chat the name of your zone and yes or no, you need more volunteers for your zone? And then at least we can copy the chat at the end and we know which zone to to target, because we, although next task for us, first task was to do that letter to resident, update the website, all that is nearly there. Next task is to recruit more volunteers. If you could let us know, then we'll use that. Bruni, are you able to take note of all of that or keep all of that? Is that all right? I can't hear you, but I can see your lips are saying yes, so that's okay.
I think it'll be easier to take it all off at the end.
Okay, cool. Let's do that. Yeah,
if not, I'll try and put it on a spreadsheet in a sec. I'll see how easy that is.
Brilliant.
Quite a few yeses, yeah.
Okay, fantastic. A few yeses, a few no's I saw as well, so there's a bit of everything. That's good. So so then how
best to recruit?
Yeah, how best to recruit. I mean, my obvious idea would be to put it on our Facebook. Maybe Anthony on Rai News, you could do a call for volunteers with direct, maybe Anthony, the URL to the website, because I think that's the best one to share, because he's got all the steps, including the acceptance of liability, as well as the SurveyMonkey. So it's better to send them there. Our volunteers are very quiet, yeah, us too, I have to admit, but hopefully, actually, when I did ask to organize for the letters for Playden, there was only a couple of people coming forward, so I'm hoping now that we actually have the letter, there'll be a few more. I don't want to be doing all of Playden. No. Okay, so any suggestion about how we recruit volunteers?
I think if it's in the villages, we've got the parish magazines. I know you've got a relationship with them, and some of the villages might have their own Facebook groups. I know, for example, for our zone, we could ask on there, because I think if you're already on the Facebook, the Rai Mutual Aid Facebook group, you're kind of invested already, aren't you? We need some new people.
I agree.
Yeah, I think Shauna asks how we did it last time, and it was just Facebook. I think we started a group, Caroline, many moons ago, said, come on, and the response was brilliant. But yeah, not the dispatchers group, but the other main RMA group has a lot of people on it, a lot more people on it than are or have ever been volunteers. So there's certainly a number of people that are interested but have never officially signed up, and we could go to them first. But yeah, I think Bruni's idea of well, finding out the zones and then asking you dispatchers from those zones where you think would be a good place to advertise that locally. And getting in touch with the parishes again, you know, seeing what they can do with their newsletters and whether they're paper ones or emails.
And I think Brett and Nikki were saying as well, potentially using the Rye and surrounding area Facebook page, community Facebook page as well. And potentially, I think at some point, didn't we use the for sale in Rye and did I think we did. We did do a message there at some point as well.
Yeah, we could do if we do a post on our page, which we don't really often use, to be honest. But if we do a post on our page, then obviously that can be shared, unlike the private group. So if we do a post on our page, then we can then share that post on whatever Rye sites we want. And also that Nextdoor app as well might be a good thing. Neil's kindly invited me to the other day. I don't know how many of you guys use it, but we could advertise it on there. But I think locally is probably better, and ideally by the people that already live in that, like Bruni said, for the villages.
And I suppose it's on the letter to resident as well. You did put a messaging, if you want to volunteer, please go to. So hopefully that will also help. Group. Editor, the pendulum. Yeah, great. Nextdoor. Yeah, there's quite a lot of ideas there. So okay, we'll copy the chat at the end. So next on the agenda was to discuss how to best communicate the protocols to volunteers. I'm very, very aware that we did that one time meeting with I don't know how many hundred people, where we went through all the protocols with Mary demonstrating. I don't know if you remember, Jen, right at the start.
Are they still on the website though? I'm pretty sure
the videos are still on the website. So I was just wondering what's the best way. So let me put that poll out. Actually, no, it's the wrong question. Actually, there's two questions, and they're both to communication. They were just put under the same poll for a reason. Sorry, my technical skills. So the first one is how best to communicate protocols to volunteers. Should we organize an online training where we go through the protocols in a bit more detail than I've done tonight? Record a video that explains those protocols, or make a short, like gather them all together in a one document that's like a PDF guidance, or then put a link to the website where all the protocols are, the page I've just shown you. Should we do that? We can then email people, volunteers by email, by WhatsApp, by a Facebook group. You're not clicking, anybody's clicking. Can you see it? Oh, yeah. Okay. And then other ideas that you may have that we might be using. So it's a multiple choice, so you can click as many as you want. That'd be great. So
Caroline, is this to explain how to deliver the leaflets? Are we talking about here?
No, it's to explain. Sorry, that's to explain to volunteers who haven't had any training or any reminder how they should, not contaminate, how they should wash their hands, how they should not go into shop 500, like all those protocols that we've got to make sure that what we do is safe. How do we remind people how to use them? Because
and there'll be new volunteers to come that
exactly, and there'll be new volunteers starting
and had all of those Zooms with us going through them.
Or if a volunteer realizes that somebody is in distress, that they can go to their dispatchers, who then will go through the listening support team and all of those things, like, so they know the extent of what we do and understand how we do and how we work, how we record things. And
could we not just create a page a bit like the dispatchers page on the website, but for the volunteers, where we at least try to summarize most of those points and kind of key you know,
would the protocol page not be enough, because he's got all of that, hasn't he? Really?
Yeah, but I think more like, you know, we've got the dispatches step by step, but we don't have anything for the volunteers, and the volunteers don't have access to that page. So we could have a volunteer step by step, just you know, listing some key things, and then, you know, I think you know, mostly we point them to the website, or we ask the dispatchers to point them to the website, and then they can pick up in their own time.
Okay, and actually lots of people are saying that, like guidance or link to website via email is the answer that people are saying the most, or recorded video. We could even have a recorded video on that website, as well as all those steps if needed. So that could be the two options we decide to use. Okay, can we actually take a print screen of that, Jen? Because last time the result didn't keep properly. Do you mind?
I don't have the result.
You don't have it. Okay. Oh, it's me. And then the second question before I end the poll. Second question, and that's also to do with communication, but it's about how do we? Obviously, we've done the letter to resident, and it's coming out to you tomorrow. We've done the Facebook post that shows your first name and telephone number. Is there any other modes of communication we need to use to keep resident informed of RMA? Most people are saying flyers at pharmacies and doctors' surgeries. If you put others, could you type in the chat what you mean by others, please? Okay, I'm going to end the polling now, and I'm going to...
Caroline, someone pointed out you could only choose one of those. So some people might have wanted to select more.
Yeah, my fault.
On that one. So it probably is a bit of more, but
it should have been a multiple choice, and you automatically put it single choice. Sorry about that. So I'm just sharing there. Need to refresh posters. Yeah, absolutely. We do have received posters. So tomorrow with the letters, some posters will come out, and also you'll have spare letters to resident because we printed too many, because it was a cheaper way of doing it. So you can use the back of that letter to resident as a poster because it's got all the numbers on them. And they'll be A4. So instead of printing extra A4s just for that, we're just going to use the back of the spare letters. So that's the idea. Jen, can you now see or no the result? No, it's okay.
Hang on. I just need to... Yes.
Okay. Great.
Yeah, I've got them.
Okay, brilliant. Thank you. I'm going to stop sharing then. So thank you for that. So we'll follow that. We'll do a guidance with an email to all the volunteers once we finish the recruitment of volunteer, obviously, and we also share it on the website, and we'll also do a video or link to the existing video, and the flyers to pharmacy and also surgery. I think it's easy enough to do. Jen, isn't it? We can do a quick flyer with just that information and have them there. Okay, fantastic. So I think I'm done with my bit. So yes, excellent. Bruni, did you want to add anything from a dispatcher's point of view, or from what you've heard from dispatchers regarding that?
No, that's fine. Apologise that when the MailChimp went out, there was an error. It didn't update the list. So I know that I sent it to people who were no longer on there, but I apologise to those ones. So no, everything's fine for me. Thank you.
And then actually, before I hand over to Jen, sorry, just the update about the letter for people who arrived a bit late. The letters will be, Patrick is collecting the letters tomorrow at 12 for the zones, for the different zone outside of Rye. So he will then be in contact with you. He's got the telephone number and the name of the person who will be receiving the leaflets, the letters in each of the villages. And for Rye, I'm hoping that we will then bring all those letters to Tina. Is Tina here? Yeah, Tina.
Yeah.
Tomorrow morning, hopefully, Tina, we're going to do that through the evening, put them in envelopes, and then hopefully tomorrow morning, I'll ask my husband to bring them up to you, if that's okay.
Tomorrow morning, I'm not going to be there because I travel behind all day tomorrow, but from 6 o'clock onwards, I'll be there tomorrow or Thursday.
Okay, so if people want their letters tomorrow, then come to mine. I'll type the address in the chat now, and I'll email people one at a time later. And you can pick them up from up here. So they should be ready. So that's for Rhizone. For Rhizone, you can then pick them up for me. Whatever hasn't been picked up, I might just then bring to Tina later.
Yeah.
And then otherwise for the villages, Patrick will be in touch for the afternoon. There will be an envelope already. We're doing that tonight with Jason. That's our lovely evening.
You mean when you say they're in envelopes?
Yeah.
Each individual one isn't in an envelope.
No.
Yeah.
I'm not. I forgot. Imagine 8,000 in envelope. No way.
Well, no, I just wasn't sure if that was.
No, we talk about it one day. I'm laughing, but no, it's not. Yeah, you're right. No, it's not.
Yeah.
You sent a message before. Who was it from? I can't find it in my email. From Caroline Drummond at yahoo.com. Caroline, yeah, you find it. Okay. When do these need? As soon as possible, but admittedly, we wanted to do that a few weeks back, and it took us that long. I think as early as we can. If it's by next weekend, that's fine. Whatever you and your volunteers can do, really. Obviously, people, they still have our contact detail from last time, so if they really want to find us, hopefully they'll be able to. But it's just a nice thing. Also, Jen, I was hoping you could show the final version, because I don't think the dispatchers have seen it. We've made a few changes after it, and there were some lovely extra messages I did about being kind and other lovely things added to it. So I think it's just a nice thing for people.
I can share screen now.
So do you want to do that, Jen? Then I think for me that's about it. I will recontact people to let them know about my address tonight for the pickup. Okay. There you go, Jason. Let me make you host. There you are. Do you want to change the host? Yeah, you're now host.
Okay. So here is the booklet. It's really just to remind people that we're still here. Obviously, things are picking up again. So, it's been 6 months since we started. The main thing is obviously to give them the updated contact details, but we thought, well, while we were doing it, it wouldn't cost any more. Let's try and give them some stories and a bit more information, so they know we've been doing stuff for the last 6 months. So just remind them how we can help them. We've got this, Katie sent us some really nice photos. Thank you, Katie. So just wanted to kind of play on that, getting out, which I know a lot of people have been doing for a walk. A little thank you to everybody involved. Reminding them that, one of our best resources is the website, and that all of the information and more is on there. Then inside we've got a piece that Hannah wrote us about the 275 masks that went to Kenya. 1,800 masks that have been created and distributed locally by the RMA sewing team. Some facts and figures, just a bit of an update really of where we are, and again a lead to refer for the listing support, mention of our donation to the food bank, and if anyone wants to donate to us, I've directed them to the website. I've put in here the letter or the email that Rebecca Gilbert sent us, because I thought that was quite touching, which applies to everybody. It thanks everybody in RMA. And then a lovely picture of Sue receiving her flowers that one of her regular beneficiaries gave her, and that famous picture of Rachel receiving her pulleyed shopping on her extension cable. And yeah, this is the box you were saying about, Caroline. If you're interested in becoming a volunteer, head to our Become a Volunteer page. And then obviously the important stuff is on the back, all the updated numbers. And I have just sort of put at the top here, just to remind people, we're all pretty much working full time now. So, no last minute requests, and reminding them that if they have alternative help, to go to them first with a date. I've also created this page at the back with a big yellow banner at the top saying updated October 2020 as a poster. I've only got printed 50 of them in A4, so yeah, so it's got this banner but at the top of the numbers list. So we'll send them out. But yeah, there'll be plenty of these booklets left over. So if someone wants to whack one up on a wall somewhere in a local shop or anything, then that's fine. So I hope it's okay. I did want to have a few more stories ideally, but it's always the hardest thing, kind of, you know, getting these little snippets of information and photos from people to, you know, to have some human stories in there. But I think that you know, that does enough. And the main objective is to let people know we're still here. Throw away your previous lists of numbers, and this is what you need from now. So Caroline's already gone over the distribution of those. I know I posted a JPEG of it a few days ago, but I'll put an updated one. I don't think anything's changed, to be honest, but tomorrow I'll put an updated one on the Ryan Michelot page, which will then be shareable. And please just share it on your own social media and everywhere, really. There's no private information. You know, it's only first names, and you all know you're on there. So share it away.
Did we change David's number? You know, David's number is incorrect.
Well, I saw that, but as far as I know, I've not been given the correct one.
I have added it to the spreadsheet.
Was it posted on the Facebook group, or did he email?
No, it was private to me, but then I've updated it on the October 20. You know, the latest update I've done when I went through everybody. That's now correct. That's now the correct number for David in it.
Okay, well, I can change it, and at least that will be correct.
That's it.
But
That's
it's
it.
not
That'd
correct on the
Thank
book.
you.
Yeah, and we'll share that. And then if anyone knows anyone that wants, you know, a massive poster, or I know there were some sandwich boards in town, and Ian at Adams tends to do an A01 one, just let me know and we can organise that. And then, yeah, I'm sure Anthony will help us get this information out in Ryan News as well. And then we'll wait for them to call. Hopefully they won't need to. But yeah, if anyone's got any other ideas of anything, then let me know. But I think less is more when it comes to letters and paperwork, and certainly distribution is pretty epic. It helps to have a big team and everyone does their area, but it's no small feat, really. Don't want to confuse people with having too many letters either. So, you know, I think that's it, really.
Jen, do you mind putting me back at the host? I forgot something. I had a phone call from RVA this morning. I forgot to mention something before I pass it on to Anthony to update us.
Yeah.
Yeah, brilliant. Thank you. Host disabled screen sharing. Oh, no, okay, cool. All right. Yeah, we had a phone call. I had a phone call this morning. Where did I put it now? From RVA. And I'm sure, Anthony, you presented that last time maybe, but just in case, they've got this project called Healthy Aging Through Innovation, HAIR. And basically what it is they have a number of volunteers that they have trained to do guided conversation with elderly people in rural Rother. So they're saying that they now need, to have people referred back to them. It's a bit like a research project, but it's a very practical one, because they will then use those findings to help develop new services on the ground, but also the people they talk to, if they find that they're lonely, they'll help them find things for them to be able to do, or people for them to connect, and they will be aware of what's happening. So I was thinking, last time we had that question, I think it was from one of your area, one of the people you work with, Bruni, and you've been supporting that lady that wouldn't go out of the house. And the lady was saying that, their volunteers might be able to then help with that, help to kind of get people walking and getting out of the house and things like that. So I thought it would be a nice thing to share, and I will share that information on the main volunteers page. But I just thought I'd share with you, dispatchers, so that you know that this exists, and that comes from RVA, Rother Voluntary Action. Sorry.
Yeah.
And it's great because they could really complement what we do. And if we find that if there's anybody that would need extra help or a chat, would benefit from a chat, they can offer between 1 and 5 chats, and then they really help people then find information they need or be put in contact or given the right numbers or etc. So I think that sounds like a lovely thing, and hopefully that can really support our work as well. There we go. That's all for me. Sure.
Yeah, I think it was Jenny, wasn't it?
Yeah.
That, Jenny, she said, that mentioned about that kind of repeat beneficiary that was kind of struggling to get back out there. Okay. My last thing is, do we need to consider other means of communication? This isn't with the volunteers as Caroline's question, but it's to do with, I guess it's from us to you guys and us to the volunteers. Do you think that what we do is suffices? Do you think, we don't want to call people in for Zooms, unnecessarily, but do you think there's anything else that we could do to make things clearer and improve the communication from us to you? Equally, from you to your volunteers, is everything going fine? Updated WhatsApps with, dispatchers who have left have been removed, I guess, and everything's going okay. Leave a comment in the chat if you think that things could run smoother using something else, whether that's online or otherwise. Caroline, you've got a poll here for that. Is that necessary, do you think?
No, it's okay. I think that was the other one, actually. That was the communication to residents, where people have been saying about the leaflets in the pharmacies and doctors.
Yeah, so we've covered that.
Yeah, but any advice on communication for whoever volunteers, dispatchers, resident, us, is very welcome, obviously.
I think most people saying Zoom's good. I will save the Zoom for when there's kind of a big update. Shauna gets confused with emails and Facebook sometimes.
Fair enough about the distribution. Absolutely, that's fair enough.
Yeah.
And I will now. I've added it in my action for tonight, and it's down on me. I was just waiting until they arrived, until we knew. They've arrived this morning, and then we'll prepare them tonight, so they will be ready to go tomorrow. So I'll email everybody tonight to expect Patrick to be in touch tomorrow, or where to come and collect them tomorrow.
Yeah. Okay. Well, if at any point you hear of or come across a system that you think would help or improve, or something that's working in your group that you want to pass on to others to maybe adopt, do just come to us and let us know. But I think mostly everything's working fine. Everyone's got their own way.
Fantastic.
If there's no other comments, I'm going to pass to Anthony for final point on the agenda, if that's okay.
There's a question there, and actually that's perfect to introduce Anthony, I think,
from
Carol. Should we recommend volunteers use the Track and Trace app, Anthony? You're on mute, Anthony.
Yes, I think there are mixed views about the Track and Trace app. I'm a skeptic, I should say. I'm appalled that so much money, time and effort and so-called expertise has been committed to it, and it's just a disgrace. As a lifetime ex-military person, they should have given it to the military years ago and it would have been working by now, but that's a personal view. And I think it's very disappointing, but nevertheless, I use it. It's good for booking into places using the QR code. And but so far it bleeps away, telling me that there is nothing happening. So I've had no alarms from my travels, but I believe people should be encouraged to use it. The more people who use it, the more likely it is to work. But I know it's full of glitches.
So many glitches.
Anyway, I shall push on with the points I was going to raise. Some of you will have heard all the big announcements yesterday. We're now moving from the rather, I won't say shambolic, but it appeared to be a rather random system of application of measures to the 3-tiered system. which is very military. I do like it. So we've now got 3 tiers: green, amber, red, level 1, level 2, level 3. It starts at medium and goes to very high. So some people are very confused about the various levels. But essentially, if you live in the north of England, in most areas, you're either in the top level or close to the top level. The risk of being in tier 3, the highest level, is creeping southwards. There are parts of London that are on the verge of tier 2, which is the next level, which is in a medium, the middle level. And then we in the southeast and south are mostly on tier 1, which is the lowest level, which for confusion is called the medium level. So leaving aside the terminology, we have got the green, amber and red. We're green. London could be amber by the end of the week. And north of Watford, many areas are red. And the idea is that armed with this categorization, there is then a suite of measures. But the suite of measures can be varied locally by regional mayors, by local authorities and so forth. And you will have heard on the news, there's been endless debate today about who's going to decide and how it's going to be decided. But anyway, we're in the lowest level, green. I won't go into numbers or statistics because depends on the source and how you portray them. But our numbers are well below all the other areas verging on amber. So we're very low in Rother. No one's been able to explain that, and there are teams of people now researching that to see exactly why that is. Whether it's climate or people obeying rules or whatever it is, we just don't know. It might just be that a lot of visitors who've come down to this part of the wood who are infected have then disappeared, and their infection is recorded in their home area, London and to the north. And therefore, if that happens, it's not recorded to anywhere in the southeast. That doesn't mean to say that a lot of people around and about that you see are not infected or have had it. So anyway, we're on these 3 tiers. We're on the lowest tier. And I've been waiting with bated breath today to hear about the shielding scheme. You'll know that until the 1st of August, 2.2 million people in the UK were sent letters by NHS to say that you're at very high risk, you're in the top category, you've got a low immune system, or you're being treated for some dreadful disease, or you've got a respiratory problem, and therefore you should stay at home. And as a result of that, an awful lot of people have been at home for 6 months, shielded. Some have crept out, but a lot of them have stayed at home. And there is an awful lot of mental health concern, depression, and that's a major concern across the piece. So they've changed the policy. And regardless now of the tiers and the measures in the tiers, there is essentially no permanent shielded list, although they are going to write to people of very high risk and suggest they adopt much higher measures than the average citizen. So as at today, if you were shielded until the 1st of August, even with this new tiering of measures, you can still go out and about, apply the rule of 6, make sure you social distance, go to the shops and do all the rest of it. But we've been warned that the guidance for the shielded may well change, or they may have a selective or tailored, they're using the term tailored guidance for specific people who are of extremely high risk. But that's not arrived yet. So what I'm intending to do is put a piece in Rhine News tomorrow which summarises the tier system, which most people will have seen, underscore the fact that we are at the lowest level, the green level, the tier 1 in Rother, and therefore infection rates, deaths and so forth are some of the lowest in the country. And to remind the shielded that they should take all precautions, but they, at the moment, by government guidance, are not required to stay at home. Now, that does rather affect the RMA operation, because had they decided that the shielded should go back into their homes and stay there, of course, we might have had a lot more customers, a lot more dependency on the RMA operation. So I don't think anything's going to change overnight, but we've not touched on it, and I need to talk to the central team to make sure that we've explained very clearly on the website who the new dependents are on Rye Mutual Aid, because we all need to be clear, volunteers need to be clear, dispatchers need to be clear. Essentially, we're talking about people with symptoms or infections. We're talking about people who are quarantined because they've been abroad or they've been in touch through track and trace. Or we're talking about self-isolators, the over 70s, who are very concerned. They may have underlying health, they may not, but they don't particularly want to come out. There are some of those about. Or there may be people in the shielded list who are so seriously ill with such serious underlying issues that the NHS write to them in the next week and say, well, really, you should seriously consider staying at home. So all those people, if they have no support from friends and family, and that's a key if, and it's very clear on the website, if they haven't got friends or family, then they should obviously contact RMA in the first instance in the 20 zones. There is a slight complication to that, and that is that today we know that the NHS Army, or whatever it was called, or is called this week, is now re-recruiting right across the piece. And they are getting fired up for community support. We know that there are other groups also providing mutual aid. Some of them are based in Hastings and are creeping out into the Rye area. So it may well be on your travels you hear of another organisation making contact, and it would be quite handy for that information to be passed back to the central team, just so that we know. I see one of my jobs as sort of deconflicting and coordinating with the many other organisations that there are about, and there are lots of them, and just to be aware of who's doing what, so that there's no mass duplication and we don't run into trouble. So that's the tiering system. That's the position really locally. As Caroline says, tasking is very low. There are no immediate problems with supply. There's an awful lot of home delivery going on. People have got into the swing of that, and people like Stephen Jensen and Mr. Morrison and all these other people are delivering food and things. The chemists are all delivering. So there's a lot of formal ways people can get food or chemicals without coming to an organisation like RMA. But I'll say some of this in my Rye News piece tomorrow, as well as updating generally on the refreshing that RMA has been doing in terms of letters and numbers and contacts and all the rest of it. My third point is really getting the act together with others. There are more and more groups. I had a long chat today with Chris Empson from Food Bank Rye. She's in the same position. She's also in touch with a host of other people around, all providing food, assistance and so forth to various groups, dementia patients, whatever it is. There are a whole lot of people, organisations based either in Rother or in Hastings. And we both made the point, and we've made the point to the MP, and I've made the point to RVA, that it would be nice if some sort of overall coordinating action could take place by a formal body. All I get is people pointing at me and being told to get on and sort it. So it's not really my job, but I am doing what I can to put people in touch and close the loops. Yeah, my final point really was the food bank. Food bank dependency is high and rising. Unemployment figures in the Rother area, eastern Rother area, are rising almost daily. And the last time I think I took part in a Zoom, I said that the unemployment office in Hastings had 500 people on their books between Rye and Northiam. I believe that figure is significantly more than that now. So there are an awful lot of people out there looking for jobs. We know from the high street that more and more businesses are closing and staff is being reduced. And we know that the hospitality, the heritage, the arts sector is all hit, and very few of us. I bidded for a lot of money for the brand new Rye Heritage Centre and didn't get a sniff of anything because it's all gone to the big names, the Towner, the Jerwood, and all the others. So sadly, there is there's a lot of unemployment out there and a lot of hardship, and I can't see it getting better anytime soon. And we now have the prospect of winter flu. Don't forget to go and get your flu jabs, very important. They're available on the high street or up in the medical centre. According to your age, you'll get a multiple flu jab, but it is, although it won't stop you catching flu, it would alleviate flu. And there is now research to suggest that the routine flu jab, whether it be a 3-component or a 4-component, can alleviate the effects of COVID should you get it. It's obviously nowhere near as effective as the stuff that Donald Trump took, but it still is extremely good and is an alleviator. And it's there. You can get it in Horrells or in Boots or the medical centre, and people should be encouraged to go and get their flu jabs. And
can I just add something there, Anthony? I think for those of you who aren't in the age range, whatever the needs are, it is quite difficult to get the flu jab at the moment. I popped into Jempson's because I was told by a friend you could get it there, and I couldn't get it. So I'm not sure. So I think it would be really useful if anyone finds anywhere that you can pay for it to be done. If you could share that, that would be really useful, and then we could all run down there and get it. But I know that Jempson's and Peasmarsh didn't have it, and Boots also said they didn't have it. That was a couple of weeks ago, but I should imagine that hasn't got any better now. So I'm not sure what that position is.
I will check on precisely what the rules are. No one asked me whether I was entitled or not. I just went in and booked. I can't imagine why. I obviously don't look as young as you, Bruni, but there's obviously an entitlement, and I don't know what it is, but there is still, if you're of the more mature age, you can certainly get it. And I think you can get it if you have certain vulnerabilities. So it's, what we'll do is I'll check on eligibility and we'll put it on the Facebook page or the website so that people know. I think that's all I have really, unless anybody's got anything for me.
Some comments about the flu jab there. I was in last Wednesday, I was over in Tenterden and I had to pop to Boots, and while I was there they've got a big queue around the back of the shop which is just for the pharmacy, and I ended up standing in it for ages before I realised I didn't need to be in that queue. But there was at least 3 people kicking off because they'd booked their flu jab online. And they said they'd never received a confirmation email, that you normally do when you book something, to say this is your appointment time. And they were all there. Clearly some of them had left work and come for it, and the girl at the till just had no recollection. She said, your name's not on the system, it's not down. And there were a lot of unhappy people. So I don't know, that sounds like a bit of a technical malfunction to me, but
I think that sadly, I don't know what the reason is. I think Boots is less reliable than some of the others. Certainly Horrells, there's a very nice gentleman in there dishing out the flu jabs, and he had a whole mix of potions according to age. So, but I didn't think to ask him about entitlement. I am seeing the MP in about 10 days, and I've got various things I'm going to tackle her about. And if people think there's a general issue about flu jabs, entitlement, supply, whatever, it would be nice to have some sort of indication, because I can raise it with her.
There's very good explanation from Brett. Nikki here says that at the minute is being reserved for the list of people over 65 and all the lists that they've put in the chat due to shortage.
Yeah, well, isn't it true? I mean, my sister-in-law works at Horrells, Moss, Day Lewis, whatever it's called, and I'm pretty sure she said that they have to be ordered like pretty much a year in advance. So back when they ordered the flu jabs, COVID wasn't even a thing. So of course, there's your explanation.
Well, of course, the winter flu jab is an annual supply, and it changes every year according to whatever's circulating. And certainly in Horrells, the supply they had was fairly recent and had arrived, but he didn't suggest there was any great shortage. But anyway, there's some very interesting stuff coming up on the right here, so I'll have to research it. For some reason, I was given it without any question, and I don't look a day over 65, so I don't know what the issue is there.
Why? Of course not. Okay, the only last thing on the agenda was Q&A, but we've been efficiently using the chat, which we'll make sure we save. I think Bruni's made a note of everybody's need for further volunteers, so that's good. And yeah, I think that's it. Welcome to any new dispatchers. Yeah, go to the website. There is a hell of a lot of information on there that was many months in the making, or maybe it wasn't, it just felt like that. And we're here, obviously, if any of you need us, or if we need you. So yeah, any ideas or anything, yeah, let us know.
Yeah,
Caroline,
get in touch. Yeah, just to say, I'm just now going to send the confirmation about the distribution. I had got in touch one at a time at the weekend to see who was for which area, but now I will send the confirmation, and that should be with you tomorrow. Please let us know when it's all done as well. It'd be nice to know that we can tick and just know that these areas have been covered. And then we will now work on recruiting more volunteers and on getting them the information they need to be volunteering. And that is it, really. I think just make sure that you keep those WhatsApp group updated, that you add people to it, and that you keep your list of volunteers and trackers up to date as well. That'd be really useful for us. But any ideas, anything else, just come to us. That'd be great. And thank you very much for your help and everything you do. And let's hope that we keep, that things continue to be rather under control locally. Anthony, did you want to add anything, Bruni?
Thing from me, thanks.
Okay, thank you very much.
Have we recorded this meeting?
Yes, we have.
Okay, fine. Yeah, I just had a few people. Sorry if people didn't know. Well, obviously you all knew about the meeting because you're all here. But I've just checked my Gmail, and quite a few people said they didn't know about the meeting. Do you think we needed to do something else? Did anybody else think, oh crikey, I didn't really know? Just need to make sure that I am getting the message out there, because
there was a message. Did you send an email last week? Didn't you?
I sent an email last week and an email today. Obviously, that was later. And it was on Facebook last week and Facebook today. So I'm not sure, but I've had about 5 or 6 people say they didn't know about it.
So maybe the emails last week didn't work or something, because I mean, if you send an email, there's no the email plus Facebook, there's not much more we can do.
Yeah, okay.
If you see what I mean, like people need to put it in their diary.
Yeah. I don't think there's anything you can do other than changing the time or the day of the email. Maybe a whole week's too long. People forget and then don't look at Facebook or something. I don't know.
Yeah. Okay, it's fine. I will. I'll let them know.
Yeah. Look, all the best ones are here. Yeah. Thank you, everybody.
Thank you. Fantastic. Thank you very much.
Thank you.
Bye. 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 Thank you. Bye.
Are we staying on?
Yeah, maybe just 2 minutes. I'm not going to stay very long. Okay. I need to be. But yes, I think it went well. I'm just going to stop the recording.